Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today we're talking all about retraining the brain, rewiring the brain, actually, with the medical, chief medical officer of a company called Alpha-Stim, Steve Haltiwanger in the house, who is an MD by background. And in his past life, before working with AlphaStem, he was also a medical director of professional formulas and the health and science director of LifeWave Inc. He'll tell us a little bit more about his background as well, but he has been a spearheader in the realm of functional medicine for many, many years, and is just a wealth of information about how to use nutrition, lifestyle, and alternative therapies as his first line of medicine, in complement to what we have in traditional medicine. So he is bridging the gaps between integrative and functional medicine and conventional, just with his extensive background in the field and profession. And Dr. Haltiwanger, I'm so happy to have you on the show, and thanks for letting me twist your arm to come on, talk a little bit about Alpha-Stim and rewiring the brain. And if you could just give us a little bit of background about who you are and what got you doing the work you're doing in the world.
Well, I don't want to spend an hour doing that. I am a psychiatrist of 36 years experience. I've been a doctor for 40 years. I have been involved in 72 research studies in biomedical field over the last 20 years. I've done extensive work with a number of companies. I've formulated nutritional products for a number of companies. I've got some patents on nutritional products that I've formulated in the past. I've written a number of papers. So, I've been basically doing scientific medicine for since I graduated medical school, which was 40 years ago. And I got into Alpha-Stim, which is made by a company called Electromedical Products. Alpha-Stim is the product that's being manufactured. The company's Electromedical, and the website is alpha-stim.com, with the dash in between is very important. There are people out there that try to basically sell cut rate devices using similar names that don't work. So you want to make sure you're getting the original if you're using an Alpha-Stim technology. Alpha-Stim has a tremendous benefit. I started using it 31 years ago in my medical practice with patients that were going through anxiety, depression, and insomnia. And it works equivalent to medication without the side effects. So it's a very powerful device.
Yeah, I know I stumbled upon you and your work just really by the company looking into Alpha-Stim. I had, been turned on to look at it from some of those in the mast cell activation syndrome community, mold illness recovery, multiple chemical sensitivity, and just as a brain retraining device for retraining that limbic system and the amygdala hijack that can happen. But a lot of the work I do in my own personal practice involves a lot of vagus nerve retraining as well, with individuals that have had eating disorders for many years and are just stuck in this fight or flight response still in their body, low vagal tone. So just really looking for alternative therapies and ways to help my patients get out of that. So would love to dive in, talk a little bit about maybe just starting there. What is the limbic system as well as the vagus nerve? Maybe some just basics about the brain.
All right, we'll start with that. Okay. Well, the limbic system is basically the area of your brain that controls emotion and memories. So if you've had a very traumatic childhood, you've literally got a scarred limbic system emotionally, and you're going to have consequences that can extend through the rest of your life. And so what happens, it creates neural circuits and pathways. It's kind of like an animal trail. Well, if you got a rabbit hopping, that's one thing. But if you got buffalo going through, you got a bigger, deeper trail than just rabbit trail. And so, what happens is people get caught up in these pathways, and they get in these dysfunctional mechanisms in their body. And AlphaStem provides a way of normalization, of renormalizing abnormal pathways, in a sense. I call it a recalibration. My best analogy I use is a computer debugging program. And so your computer works better if you debug it. Well, AlphaStem, it has some unique properties, and it's important to understand, first off, the electrical properties of the body control the chemistry. Not a well-known fact. I bet you will only find 2 doctors out of 100 that understand that the electrical properties control the chemistry. And once you understand that, then you begin to understand the importance of rebalancing the electrical properties of your nervous system, because you can't get chemistry in balance without them. And the next thing you have to understand is low is better than high. The lower you go, the better the response. And AlphaStem is at the same level that the nerves communicate at, so we're not overpowering the system. And everybody thinks, well, if a little's good, the lot's a lot better. Well, go plant a garden and then have an 18-inch thunderstorm come by and rain your garden out. You'll basically have nothing because it's all been destroyed. And the same thing happens if you overpower the brain or the nervous system. You don't create normalization, you create dysfunction.
Talk a little bit about the current paradigm and treatment approach, both in conventional and perhaps integrative medicine that we take that may not be on par with what you're discussing right now. So anxiety, thinking, eating disorders, I'm sure you've seen the works in your practice.
Yeah, absolutely. Well, first off, I think you need to start off with I like to think about it from a building a house point of view. Because most people, you have to talk in a level that people have some kind of understanding. If you're building a house, you buy a lot, you clear it, you detoxify the body. So the first thing you do is you recognize the proper diet is helpful, keeping the diet as clean as possible, and removing, toxins as best you can is important. Next, you got to have a plan. You can't just start nailing boards together and, I got a hotel, we're going to start nailing boards. Go nail some boards together up there. Not going to be very well. Well, the body already has the plan. God already put the plan outside each cell of the body. Each cell can grow an entire person, each cell. And so plan's there. Now you got to have construction materials, and you got to have power, energy. Well, nervous system provides a great deal of energy and is a way of redirecting and controlling that energy. So that's a very important aspect. But the other aspect is construction. And there are certain vital, what you call essential nutrients that are required in the body. And every essential nutrient has specific functions. And without it, there's always abnormality. And so from the point of view of general or standard medical care, we completely ignore this. We do not see doctors recognizing that drugs that they give can actually cause a syndrome called nutrient deficiency, nutrient depletion, drug-induced nutrient depletion. It's one thing. So I don't have a problem with drugs. Medications properly prescribed and properly monitored for certain conditions. I have a problem with people having a complete lack of awareness of the physiological impact they have on people. I had a young man that talked to me today that was on 6 different psychiatric drugs, and he was wondering why he was not feeling well. And we went through and I had him look up each drug and then the term nutrient depletion, and he went through and identified 12 possible compounds that might be out of balance in his body. And I said, well, you need to talk with your doctor and see about getting yourself checked out. I can't give you that advice, but I can tell you that what you want to do is you want to have a consultation with somebody who's qualified to give you an opinion, because all I said is just check this out and then make a decision for yourself.
Yeah. So basically giving people the tools is something that AlphaStem can provide. It sounds.
Yeah, that wasn't an AlphaStem content. That was one of my private patients that I'd seen from years ago that called me at my lunchtime and wanted to have, and I said, look, yes, I used to take care of you. And yes, you still have my phone number, but I cannot see you now as a patient. You have to see somebody else, and you're not going to fix it by just taking these medications.
Yeah, kind of I see that a lot in my practice as well. Just come in with, whether it's medications or bags of supplements, just trying to supplement our way out of, we say HPA axis dysfunction or dysregulation. Can you talk a little bit about the HPA axis and what that is and how that involves the brain?
Well, we're talking about hypothalamic pituitary adrenal axis.
Mm-hmm.
Okay. Well, first off, we know that AlphaStem will send signals through the nerves that innervate the ear into the brainstem, up to the limbic system, to the hypothalamus. And as a result, it will cause neurotransmitter release, and it will also cause the body to go into a parasympathetic state, a relaxation state. So you're getting a relaxation effect. And one of the ways this is manifested is the brain waves go into an alpha state, which are a synchronizing, resting state of the brain. So alpha state is the state of peace and calm. And so we move the brain into a calm, peaceful state with the AlphaStem, and we get the hypothalamic pituitary axis try to renormalize. Because what happens with people is there's the autonomic nervous system has a sympathetic, the accelerator, and the parasympathetic, which is the brakes. And some people are just constantly stimulated, and they get set in what I call a sympathetic dominant state. And they can't slow down. They're tense. They've got to go, or their body is exhausted. They've gone over the curve, and they're in a state of exhaustion. And what occurs is when you're using that sympathetic activation all the time, you're also stimulating the adrenal glands, which are putting out hormones constantly. Well, you can get into a state of adrenal exhaustion. And and this often occurs with people because the adrenal glands, like any other organ, require certain fuel stock in order to make the hormones. And some of this fuel stock includes vitamin C, minerals like zinc, B5. These are some of the more important ones for adrenal function. And so it's not uncommon during a stress reaction for the body to actually lose vitamin C, zinc, magnesium, B1, and other vitamins through the urine. And the body will mobilize these because they're important. But as a result of mobilizing them for the adrenals and other organs that need it, some is lost in the urine. So if the stress reaction continues over a period of time, they actually go into a nutrient depletion syndrome just from stress, emotional or physical stress. Mm-hmm. And then they wonder why I'm not sleeping anymore. All of a sudden, I'm anxious. I never had anxiety before, but now I can't sleep and I can't calm down. And that's when they contact us at AlphaStem. It's a prescription device. You have to have a licensed medical practitioner, health practitioner, write the prescription for the device. And then we have a clinical support team that can answer questions and help people and guide people. We have representatives that can actually answer questions also. So there's a lot of support. This is a great company for helping people get through their transitional periods. And some people it's very rapid response, and other people it's slow. But the great majority of people, 80% of people, have a benefit.
Talk to me a little bit about how you explain to patients, like in the past and currently, who recognize they can verbalize stress as part of how they're feeling, and yet it's still it's hard to conceptualize like how stress is part of what they're feeling. So, for example, I have this conversation a lot. Like, I think stress is what's driving your IBS or your constipation or your autoimmunity. Okay, yeah, I know I'm stressed. I know that's part of it. Like, what's the supplement to take? Or like, what should I eat? Diet. Like, it seems like the proactive things we can do are diet and supplements in the human mind, but like to actually understand how stress is working in the body and how does like using a device change that?
Let's get to the device as part of that answer, but let's start off with you're a human being and you have certain requirements. One is you need to have some type of exercise program because that has an anti-stress effect by itself. Next thing is not missing meals and eating quality food. Absolutely critical. Going to bed early enough so you may have a chance of getting some sleep. Just losing sleep enough alone is enough to stress the body. And a person that goes through lots of sleep deprivation has total stress. I've been through it in my medical practice There were periods of time when it was just so busy that I would sleep an hour or two a night. And after about a week of that, I was like collapsing. And it was a horrible feeling. So, I mean, I know how it feels personally. And I had to make arrangements to cut back, take time off and stuff. So you have to take care of the machine. You don't redline the Corvette and drive it into the highest RPM you can because you burn out the motor. Well, the same thing with your body. Now, AlphaStim can come in and it can help reset your nervous system. I call it a recalibration effect, where it calms that out of that hyper stress state into a more relaxed state. Now, in some people, it's very rapid, and other people, it's slower response. But we have found there's a cumulative effect. So if you stay with it over 6 to 8 weeks, 80% or more will have a good response. So the biggest thing as a practitioner that I do is get them to stick with it, is be patient. It's not a magic black box. Here, you get this. Here's this box, this electronic device. Put it on, it's going to cure your problem. It doesn't work that way. But it can help bring your nervous system and recalibrate you back to a calmer, more equilibrium, a calmer state of equilibrium where you feel better. And it actually turns off that accelerator mechanism that's going on. It calms down that hypothalamic pituitary axis, HPA axis that you've got. And so it has some beneficial anti-stress effects. Now, of course, a good diet is also important, and to recognize the role of proper nutrition. And I can only tell you the key thing that I've learned the most effective with AlphaStem is essential nutrients. If you understand the concept of essential nutrients, you're going to be so far ahead of the game than a person who doesn't.
Mm-hmm. Just like putting in essential nutrients to benefit as well.
Well, it's like you're going to build a house, but we don't have any nails.
Turn the brain on.
Good luck with that house building.
Yeah. Talk a little bit about, so is AlphaStem, is it microcurrent therapy? Is that what it is?
It is. It absolutely. It is a microcurrent, but it's not a regular microcurrent device. AlphaStem is a patented technology. It gets a little technical here. It's got what's called a unique waveform that comes in, and it creates literally, although you're starting with a half a hertz, 0.5 hertz frequency, what you wound up with is, because the way the device is developed, you're literally giving the body thousands of frequencies. And some of these are going to match up with cellular components, and it's going to cause a release of chemicals as if you gave small doses of certain drugs without the side effects of the drugs. Mm-hmm. So it's called a receptor activation. The technical term is electroconformational coupling. You want to know that?
Yeah, talk a little bit about how that is working, how you're using like a device like that. Is it like trodes you put on your head, or is it just a device you hold up by your head? Oh,
the AlphaStem is based on ear clips. The electrodes are designed to clip onto the earlobes. They have these little applicators called PEEPs, and you wet them, and they're adhesive applicators that put on the metal ear clips. You wet them with a conducting solution. I like to have the earlobes cleaned first with alcohol to decrease skin oils. And then you turn the device on and you adjust it till you get an uncomfortable sensation, and you back it down. Now, sometimes people have very low tolerance. They can't go very high. Other people can go all the way. It doesn't bother them. But I usually like to get them between 1 to 3 to 1 to 4 on the device, which makes more sense when you see it. It's 100 to 400 microamps. And what happens is, what we're doing is, there are 4 cranial nerves, actually, if you include the 5 cranial nerves that innervate the ear. And so what happens is, we're actually sending signals back through those cranial nerves up through your neck into the back of your brain, into the entire head. So as we have basically interstate highway entrance ramp into the entire brain by the ears, and it stimulates these cranial nerves. We also get some vagal nerve stimulation, because the vagus nerve innervates just a half an inch or less away from where we're putting the electrodes. And so it's like when you stimulate with electricity, it's like dropping a rock in a pond. Well, those electrical waves will just expand out 300 in all directions, but will primarily go into the conductive material. And since nerve tissue is very conductive, it will just be attracted like, water going into a river system. And so it just travels up through the nervous system into the brain, through the limbic system, into all the lobes of the brain, and it rebalances.
And then what would like a typical treatment or therapy like timeline look like, both in the act of using the device on a daily basis for 5 minutes, 10 minutes, and then also the trajectory of like using it? Is it like if you don't use it, you lose it?
Well, that's a great question. One is, usual is 20 minutes to 60 minutes. Most people will start with 20. It depends on how severe their condition is, whether they may need to be using a longer duration. What you're doing is you're giving a dosage effect of charge. And so the charge is determined by the length of time you use it and the intensity of the current. So I can increase charge by going from 20 to 40, or I can increase the current from, say, 100 to 200 microamps, and I increase dosage that way. So I have two ways of increasing the dosage. And so what we want people to have a relaxing response. If you turn it up too high, you overstimulate. You start getting dizzy, or you get nauseated, or you get a headache. And so we tell people, don't go higher than a comfort level. And so it's not, all of our side effects are very transient and short term, but so what we tell people is turn it up till you feel a little floaty. And at that point, that's high enough. You do not have to feel it for it to work. Not everybody feels it. As a matter of fact, we do all our research at 100 microamps, which is what they call subsensory. So you can't tell it's even on. And so that way we can do research with active and what they call sham devices, where everything lights up and counts down, but they're getting no treatment. And then we get the studies. And what we find is the longer the treatment goes on, the greater the accumulation begins, effect, and it persists. We had a study done in England where one of the components we looked at was sleep. And so we did it over 3 months. They did daily treatments for 3 months, and they slept significantly better. We stopped the study at 3 months, no more treatment, and went back and looked at that group of people, 161 people. And what do we find? More people continued to improve in their sleep. And the study, after 3 months more without treatment, even more people had improved. So they didn't go backwards. They continued to improve because they were renormalizing their brain, and it just took a little bit longer for some of them to get the effect.
What would people notice just like in their own effect? Like, I'm all of a sudden feeling like rainbows and butterflies if I've been really anxious all the time, or like, what is a typical response you see and report?
Well, if you know what a bell curve is, you have a curve where you have the population under the curve. You have the group of super fast responders that use it 1 or 2 times and go, oh my God, this has changed my life. We love that. It's wonderful. It doesn't happen all the time. It happens occasionally. But most of the time, you start seeing a little bit of effect over the first 3 or 4 days, slightly, and then it kind of continues to build. And by the 3rd week, you're going, yeah, I'm starting to see something happening. And by the 6th week, you're going, hey, this has really helped me. And so it's usually a gradual effect where what I tell people is write down all the things that are bothering you. And that way you can go back and look at it. I had a farmer one time I treated with this, and he was one of those sour pickle type. And he came in with his wife, and he was depressed and anxious. And I got a list of 21 things he was complaining about. And so I gave him the AlphaStem alone. I had it at my office. He used it for 4 weeks. He comes back for an appointment, and he's like, how's it doing? Oh, ain't no better. I said, well, and his wife turns and says, yes, you are. And I said, so we started making a list of the 21 things he had complained. Only 3 of them hadn't resolved. But as far as he's concerned, those other 18 didn't matter. It's those 3 things that still bothered him. But he had a big change. His wife was noticing it, the effect. So, not everybody is kind of like cognitively aware. And he was a good example of that. But most people will notice that they start feeling better. They start sleeping better. They don't feel as stressed out or anxious in situations. And they actually look forward to their treatment. Mm-hmm. I usually do it when I'm working on a computer or watching TV.
Are there any side effects?
Yes. They're very mild. You can get a little skin irritation some people want to wear it for hours every day. Well, if you're doing that, you need to move the electrode around a little bit so you're not constantly electrically stimulating the same little patch of skin. And you also need to make sure you got it completely wet, because if it dries out a little bit, instead of the electrical being in a large surface area, you start getting point source of electricity, like a little sparks. It's not a spark, but it's to give you the example. And so it starts irritating the skin. And some people can get headaches, but usually it's all that's related to intensity of use. I like the philosophy of go low, go slow with a lot of people, is start off with 20 minutes. Let's see how you're doing. This is more of a marathon. It's not a sprint. We're going to start low. Once you get a comfort level, you're comfortable that this isn't going to hurt you, and you're not scared of it anymore. Because a lot of people, I'll put electricity in my brain. I heard that causes seizures. Well, it doesn't. Alpha-Stim does not cause a seizure. It doesn't help seizures, but it doesn't cause them either. That was the first question I had when I started using them 31 years ago. Does this thing cause seizures? It's a very important question, but it doesn't. But so what we do is we want to let them, over the next day or two, they can adjust it up a little bit more. They can start off adjusting it higher. That's not a problem. But I tend to work people very comfortably. It's like walking up a set of stairs. You don't jump from the bottom stair to the top stair. You walk up one stair at a time. And so adjust it up over a day or two. You're going to have a higher comfort level. You're not going to be anxious about it. You're more likely to stick with it. So that's just a philosophy I have. The other way of approaching it is just to go in there, adjust it up to your level of discomfort and back down and stick with that. So both ways work. So I get people, depends on how nervous they are, on how slow I go.
Go low and slow is always a good rule of thumb, I think, in multiple areas.
What's the worst case? It takes them a day longer to get better?
Yeah. Yeah, just keep swimming, Nemo. Well, I kind of want to shift gears a little bit to also talk about an interesting research study you had tipped me off to, which is our case study more so. Your work as a doctor / functional medicine practitioner, evolving, leading the movement, and using nutrients as medicine in the hospital setting. Talk to us a little bit about that.
Yeah, it's an article I published on ResearchGate under my name called Clinical Experience with Nutrition in Hospitals 2.0. There's a 1.0 version, but the 2.0 is more correct. This was a 60-year-old woman who had 4 children. 2 were doctors that knew me personally and referred patients. One was a lawyer, one was a CPA. There was a very affluent family. She went into a major medical school hospital for bypass surgery, and she came out incoherent of surgery. And so they kept her on the surgical unit for a week, and she stayed completely confused and incoherent, and they transferred to a psychiatric unit where they kept her for 3.5 months. And they tried her on all kinds of psychiatric medications, and they had her on, when she came to see me, I think it was either 11 or 13 medications. And so what happened is after 3.5 months on the psych unit, they determined she was permanently brain damaged, and they advised the family to take her, put her in an Alzheimer's unit. Well, the family was affluent, as I said, so they took her home and got round-the-clock nursing care. But she was so agitated and just confused, literally they had to have 2 people with each shift. And so they just decided she wasn't getting better. They brought her into the hospital to see if I could do something. So when I evaluated her, she'd lost, I read the record, she had lost 40 pounds. She'd been on a lot of different medications. And one of the things I mentioned earlier is I had a knowledge base that if you were on certain medications, it can actually interfere with your nutrient levels in your body. And so she was on medication that would stop stomach acid. Well, that stops your absorption of your minerals, and it stops your proper digestion of your proteins, which means that you won't be able to absorb your amino acids. It also interferes with your B vitamin chemistry, et cetera. And so she was on medication after medication like this. She was on a low cholesterol diet, so she wasn't getting proper fats, and she lost 40 pounds in the hospital. And so I get her in, see me. Her lab tests were all abnormal as far as liver enzymes, so I knew she was toxic from all the medications. So a person, when you're poisoned or toxic with medications, you don't add more medication on. You let the liver rest. So I took her off all I think it was 13. I took her off 12 medications with the agreement of her 2 physician sons. I reviewed what I was going to do, and I took her off these medications. And I had her on a special hospital unit with very highly trained nurses that knew how to deal with medically ill seniors. It was a geriatric unit, a geriatric medical unit. So they knew how to deal with these people. A lot of them worked in the intensive care unit on other shifts. So they knew what they were doing. And so I started on a nutrition program. I anticipated from her looking at her, and without going to detail, it took like 26 pages to write this up. Basically, what I found out, she was lacking 21 essential compounds. Lack of any essential compound always leads to dysfunction. And so she was way out of balance in minerals, fats, amino acids, and vitamins. I simply gave her a cocktail of the vitamins and minerals that I thought she needed and the fats, and put her on a vegetable juices, additional. I had a juicer I had bought for the hospital, and my patients had to drink vegetable juice twice a day. So I put her on that. I put her on protein shakes, and this is a psychiatric hospital. So I don't have her on any psychiatric medication. And so the insurance company decided she didn't need to be hospitalized because I wasn't giving her appropriate treatment because I didn't put her on a psychiatric medication. So we had to fight with the insurance company to keep her in the hospital. And this went on after the first 4 or 5 days, a daily 1-hour meeting with the insurance representative to get 1 day approval. And so after 11 days of that, they refused to pay for any more hospitalization because obviously I was a complete quack. I didn't know anything I was doing because I believed in what's called orthomolecular psychiatry, which means the right molecule. And despite the insurance company's pushback, she continued to improve. So at about the third, fourth, or fifth day, she grabbed a spoon from the nurse that was feeding her and started feeding herself. At that point, she started improving. And what we found were all these abnormalities. The lab work finally came back, pretty much had confirmed, but, because I'd actually been to a pond before and seen animals floating in the water going quack, quack, quack. And I actually knew that was a duck. So after I've seen one, and I've seen hundreds of them, I realized I was looking at a duck. And so I gave her the proper nutrient to correct what I saw were known abnormalities. And it's all written up in the paper. And, well, she went home and did well. And within 6 weeks of being out of the hospital, she was driving her car and playing bridge. A person who was going to an Alzheimer's unit.
What a cool case study. Like, that should be a movie made after that.
It would be a great movie. It's just, the issue is, it was just a knowledge. Okay, look, the brain uses 1/5 of the oxygen, 1/5 of your energy, 1/5, 1/50th of your body uses 1/5 of the resources, except if you're under a lot of mental work, and they could go up to 2/5. Mm-hmm. You could actually get up to 40% of your energy is being used by your brain in the form of glucose. Well, if you burn glucose, there's waste products produced. There's also certain nutrients that are used up. So a person that's under a lot of mental stress is going to lose certain minerals and vitamins just in running the machinery. It's kind of like, I don't know why I run out of gas. I used to drive to my work every day and I had plenty of gas. Where'd you work? I live 3 miles from the house. Where do you work now? Well, it's 45 miles away. Mm-hmm. You think maybe you're driving longer distances while you run out of gas now? Because you're using more gas? Oh, I didn't think about that. So the issue is the body is being put under the stress. You're going to use up your resources. What happens when you run out of resources? What happens with crops run out of water? It's not complicated. It's a philosophy of approach. And the philosophy is you got to give the body what it requires. These are not optional materials. Mm-hmm. They're required.
Why aren't we using, it seems so essential that, especially for individuals in the hospital, like they're serving the sickest of patients the worst food, or just like not the most healing diet. And it's really cool that you got the hospital to serve her fresh vegetable juice daily, her 2 scoops of whey protein powder, and her flaxseed oil, all the things that are not typical for a hospital. Why?
It's because they're not magic bullets. Mm-hmm. People go to the doctor to get the prescription, the little white piece of paper, and it's going to fix their problem. And they don't realize it might reduce some of the problems that they got or symptoms, but many times, unless it's an infection, it's not going to fix it. It's going to maintain it. If we were treating your condition, Why haven't we resolved it? Why do you still have it? I had patients that had incurable conditions that got cured. I wasn't supposed to cure them. I just accidentally cured them. All the cures that I came up with were mostly accidental. I was just improving all the factors in their favor that I could. Everything. Electrical balance of their nervous system, nutritional status of their body, etc. And they got better. And what I began to realize is a philosophical approach where you have to understand, if you've got, like, say, 45 different compounds that are absolutely required, and I never can remember, it's 45 or 49 or whatever, 39. It's about 40, somewhere in there. Mm-hmm. If you got 40 compounds, let's say, that are absolutely required, essential nutrients, there are no substitutes, do not pass go. I'll give you another example. I used to work at a mental retardation center, and they brought me in to get kids off medication. So everybody was on high doses of medication like Thorazine and Melaril. They're sitting around drooling, because these were the worst of the mentally retarded, cognitively impaired. I mean, people that are violent with themselves and other people. And so the state mandated they had to start doing less chemical restraints. They brought me in. Well, I evaluated the situation. I started ordering lab work on everybody they brought to me. And one of the things I did was order their vitamin and mineral levels. Well, every person I checked was zinc deficient. 100% across the board. I got to about 45 before they wouldn't let me order more zinc levels. So 45 out of 45, I figured pretty much the rest of them, there are like 120 kids there and adults. They're probably going to be zinc deficient too. And it's a complicated story. It has to do with probiotics and microorganisms and abnormal bacteria and digestive problems and the fact that they were on constant antibiotics and stuff and constant medication. But the problem is they were all zinc deficient. And so I ordered zinc. Well, guess what? Medicaid in Georgia didn't have zinc on the formulary. Mm-hmm. I couldn't give them zinc, but that's what was deficient. And so I had to write a letter to the pharmacy board. And I did this like the first of every month for about 3-4 months. And the fourth time they said, look, we're going to let you give them zinc. So the board sent me a thing. You have permission to give these kids zinc. Well, we dropped antibiotic use at that facility by 400% the first year. 400% less antibiotic used. And we got most of those kids off of drugs by just changing their diet a little bit and changing their nutritional status. Not only do we get them on some zinc, we got them on some other vitamins and minerals, and they did a lot better because their brains were actually working a little bit better. Mm-hmm. Hard to train somebody that can't remember. I call it goldfish brain. A goldfish, swims from one side of the bowl to the other, can't remember what it did when it gets to the other side.
Yeah, I love that. That is a goldfish brain. You're right. Well, I love how in your paper too, you just say point and blank, I think it's medically irresponsible, if not downright malpractice, for doctors to chronically prescribe pharmaceutical compounds that affect cellular functions without ensuring that the metabolic pathways that detox these compounds are properly and continually functioning. And it just really brings to mind, I spent 4 years accumulated of my own life in eating disorder treatment centers, in and out of them. And a common therapy approach was to just prescribe the Prozac or the Zoloft or whatever it was, while also eating my pizza and Pop-Tart diet. And so it was just really, looking back on it, I've learned so much as a clinician now about that approach and why perhaps relapse was recurrent year after year. But I know doctors, it could be considered malpractice or just not right to medically irresponsible. How in the same light, do doctors not know what they don't know? Are these things in medical school that they should be learning, even if you're not learning nutrition?
I don't like to go down the conspiracy tunnel too far. Mm-hmm. Let's just put it this way. Medical school got co-opted by the pharmaceutical company starting in 1910. And they decided they were going to do scientific medicine. And if it wasn't scientific, you couldn't be used. Well, scientific medicine was chemistry. Mm-hmm. And so medicine had to be chemistry. Physics wasn't thought of in medicine. At that time, almost every doctor in the United States had electrical therapies. But since they couldn't explain how they worked, they had to be unscientific. I don't know why it works. It makes them feel better. Well, it's not scientific, so we can't use those. And so they got rid of herbalism and homeopathy and electrical therapies and other types of therapy like this. And we got into chemistry. And so what begins to happen is all the literature is basically funded by pharmaceutical companies. And so if the only thing you read is papers on trying to treat disease with drugs and medication, then you think that's the only way to go. And it is an effective way for certain things, but it's not the only option. And it can be significantly modified by recognizing the human body requires certain dietary materials in order to operate properly. It's a machine, a biological machine. And biological machine has got to have certain things. I tell people all the time is that tell me which critical liquid is not needed for your car. Do you want to get rid of the brake fluid? Let's start getting rid of the brake fluid to start with. You can drive your car without brake fluid. You can't stop it very well, but you can drive it. Well, let's get rid of the oil. You can drive your car without oil. Not very long because the motor is going to seize up, but you can get by. What about gas? No, you can't start it. Okay, you got to have gas. Windshield wiper fluid. Well, we might get by without that for a while. Battery fluid? Nope, can't get by without that. Transmission fluid. You can get by without transmission fluid. Almost, but you can't go very far. So what you begin to recognize is all these fluids are important. They all have different roles. And if you take one away, there's a consequence. Now, maybe you can get by without the windshield wiper fluid, but you sure don't want to get by without your brake fluid and your oil. Once you understand that, it's not a hard stretch to recognize that what do farmers put on their field? Fertilizers. Why do they put on fertilizers? The plants need them to grow. What's in fertilizers? Well, most of them are minerals. There are other things you could use, but most of people just stick with certain minerals. Why do they put them on? Because they won't grow without them. Well, it's not complicated once you step back and look at the thing. It's just we've been programmed to think healthcare comes out of a person with a white coat and a prescription pad, and you go to the pharmacy and you take this and you're treating your condition. You're basically maintaining a situation, but you're not resolving it.
Dr. Haltiwanger, I could talk to you all day long about just your role and your work in functional medicine and what you're doing right now. Where can people find out more about you, AlphaStem, and all the things?
Alpha-Stim.com has over 100 research studies on the website. It's an extensive literature review of the benefits of this technology for the 4 primary indications of anxiety, insomnia, depression, and pain. It is a very effective technology. We have wonderful benefits. 60% of the sales go to the Department of Defense and the VA hospitals. The government spent years looking at this technology before they decided to use it. And so we just now are getting accepted by the United Kingdom as a primary treatment for anxiety in England now. So that's going to be happening sometime later this year or early next year. So it's slowly coming to be taken. People are becoming aware of the benefits, is what I'm trying to say. AlphaStim, like, well, I've been around for a while. How come I don't heard it? We don't have $1 billion budget like pharmaceutical companies get on TV.
Yeah,
they're a small company, but they're a vital company and a very professional company.
I will definitely post links in the show notes for people to connect. And thanks again so much for coming on and helping us break some rules.
You're welcome.